Welcome and thank you everyone who's joined us so far. We're going to wait a few minutes to give some other participants time to join and then we'll get started. Again, thank you to those of you who have joined us already. We will wait a few more minutes before we get started. Hello, my name is Damaris Brooks. I'm the Interim Vice President of School and Community Programs at the Child Mind Institute. I'd like to welcome you to this webinar and thank you for taking the time to join us today. So what's brought us together? The Child Mind Institute has partnered with the Steve Fund and Morgan Stanley to study and develop a better understanding of the core issues faced by Black families and young Black adults struggling to access mental health care and to identify appropriate resources and supports. During our webinar today, we will discuss three overarching themes of the literature review, discuss key findings with our panelists, and conclude with an audience Q&A. Before we get started, I'd like to introduce our panelists. Dr. Rhonda Boyd is a licensed psychologist specializing in the evaluation and treatment of youth with depression. She's an associate director of the Children's Hospital of Philadelphia's Child and Adolescent Mood Program and an associate professor of psychology at the University of Pennsylvania. Dr. Kimberly Alexander is a psychologist in the Mood Center at the Child Mind Institute. She specializes in the application of evidence-based treatment for youth and young adults who struggle with academic disengagement and school refusal, socioeconomic pressures, difficulties with racial and ethnic identity development, as well as depression, anxiety, ADHD, and learning disabilities. And Jonathan Valor is a member of the Child Mind Institute's Youth Mental Health Academy and a senior at Compton Centennial High School. And finally, I'd like to introduce our presenter, Faith Wilkins. Faith is a staff writer at the Child Mind Institute and coordinator of the Mental Health Support for Black Families study. Faith is going to take us through the study and findings with opportunities for the panel to provide additional context and considerations. Faith.
Thank you, Damaris. So for this study, we have partnered with the Steve Fund, which is a nonprofit organization that provides mental health support to young people of color, and our work is made possible by the Morgan Stanley Alliance for Children's Mental Health. The objective of this study is to better understand the core issues faced by Black families and youth when trying to access mental health care. We believe this type of study is crucial because while rates of mental health challenges and suicide continue to rise among Black youth, there is a deficit in the research and literature centering the mental health of Black families and youth. And we wanted to make clear that the Black community is not a monolith, but rather a diverse group of people with different backgrounds and cultures. Therefore, the participants included are those who identify as Black and/or African American, Afro-Latino, Afro-Caribbean, African immigrants, and other members of the African diaspora. The deliverables of this study include the literature review, which has been completed and I will be presenting today. It also includes a nationally representative survey, which includes 1,500 participants, 1,000 of which being parents of Black children 17 and under, and 500 Black young adults 17 to 24. We will also be creating 3 articles for the Child Mind Institute's Family Resource Center based on the findings found in the study. We will be co-writing with the Steve Fund a final report, which will then be published on our website as well as the Steve Fund website and the Morgan Stanley website. And once the study is complete next spring, we will have a second panel discussion where we will discuss the key findings from the study. The Steve Fund will also use results from the study to launch a few projects, which includes their Ask the Expert series, mental health knowledge and skill building workshops for Black families, and a featured speaker series where experts will speak more in depth about the key findings of the study. The literature review was written by Debbie Cohen, who is a freelance writer under the Steve Fund. It focused exclusively on academic and peer-reviewed literature. It was limited to research published within the last 5 years, and after an initial review of more than 130 research papers, 48 were found to meet all the points in the criteria we were looking for. For instance, we wanted to make sure that quantitative data was included in these studies. For this topic in particular, a lot of the research out there is qualitative and lacks concrete evidence. Key topics involved in this literature review are systemic barriers, culture and family, barriers within the mental health care system, and intervention initiatives. First, I will be discussing the systemic barriers often faced by Black families and youth when trying to access mental health care. Within the research, cost was found to be a major source of concern for Black families and youth when seeking mental health treatment. Parents expressed the need to focus on more immediate survival concerns, like making sure they have a stable place to live and food on the table, with their child's mental health unfortunately having to be placed on the back burner. And in a recent survey of college students, Black students reported that financial issues kept them from seeking care. The next major source of concern for Black families and youth was insurance related. And this could include either not having insurance, the most available mental health care providers for them not being in network, or that they were on Medicaid, but their providers would not accept Medicaid, or Medicaid did not provide the amount of funds they needed for mental health care needs. Families also reported having a lot of logistical issues in terms of receiving care. So that would include a lack of transportation, also being too far away from any form of public transportation, inconvenient appointment times or long wait times for scheduling, and also having no access to childcare. This also included a lack of information overall about mental health in general, including mental health disorders, available treatments, or how they would even be able to access mental health care services.
Thank you, Faith. So let's pause to reflect on this information about systemic barriers. Dr. Alexander, Can you talk a little bit more about how the cost of care and insurance can be a barrier for Black families when seeking treatment?
Yeah, definitely. It's a great question because first you want to think about all of the factors that really contribute to mental health care treatment being the cost that it is, and so costly at times, right? So both the specialized training that clinicians may receive in a specific treatment model, or the range of treatments offered by the whatever the facility is, or even the length of treatment, both in terms of like session time, 30 to 60 minutes per session versus like the type of program, so how many sessions for that program. It can be really challenging to find, a provider that would accept insurance, given the length of treatment. And even for some providers that are accepting insurance, insurance may not cover that full fee for service, right? So there may be a copay, as well as you saw in the previous slides, like talking about transportation costs to even relocate to wherever the treatment is being provided. So I think that providers, I think it's a fair ask to like seek a provider that's in network, right? We typically do that for PCPs and other specialists, so it makes sense why we would want a mental health care provider that's in network. And for those that may be out of network, that, checking in with the provider on sliding scale fees. So some providers might actually offer services based on the individual's income and may adjust for that, as well as financial aid, or even payment plans. But ultimately, if you're thinking of treatment being on average, the research really shows that treatment could be from a month and a half to up to 6 months. And, and that's just based on the research. We may see patients for up to a year or more, and that you really want to speak with the provider about how to mitigate those costs and those out-of-pocket expenses, and see what the resources are that they can provide.
Thank you very much. Faith, please continue.
Thank you. So next, I will be discussing the barriers often faced by Black families and youth within the mental health care system. Research has found that racial bias and discrimination is a significant barrier to care for families at every level. For instance, in one study, Black patients were much less likely to receive appointments and more likely to face long wait times than their white counterparts at the same mental health facilities. And in several studies, Black parents and youth reported having negative experiences and facing discrimination from their providers, leading them to avoid seeking mental health care services. And in a study of school-based clinicians, providers were found to often associate harmful stereotypes such as delinquency and rule breaking or anger and aggression to Black students. The association of anger and aggression to Black youth often led to the overdiagnosis of oppositional, defiant, and conduct disorders, and the underdiagnosis of other disorders that could also lead to non-compliant behavior, such as ADHD or depression. Several studies also found that a lack of cultural understanding among mental health care providers serve as another significant barrier to care. Many Black parents reported that they felt as if their input was not valued by clinicians, and that several aspects of their child's care, such as use of medications or treatment, were not fully explained. And a study focused specifically on child and adolescent psychiatrists who were facing a growing population of African immigrants and refugees. Many providers noted challenges in effectively explaining diagnosis and treatment to their patients due to a lack of understanding of cultural differences and cultural family practices. And in several focus groups of college students, Black students were found to be a lot less likely to seek out mental health care services if they knew that Black providers were not available, explaining that they didn't feel like non-Black clinicians would understand their struggles or where they were coming from. And in terms of diagnosis and treatment, Black parents were much more likely to report unsatisfactory quality of care for their children than white or non-Black parents. And scientists have noted that this could be due to the fact that a large amount of mental health research out there mainly focuses on white participants, which ultimately leads to risk factors and symptoms specific to Black children being overlooked. And when compared to white children, Black children were much more likely to receive diagnosis for externalizing disorders such as oppositional defiant disorder or ADHD, and less likely to be diagnosed with mood disorders such as anxiety and depression.
Thank you, Faith. I'd like to pose a few questions to the panel about culture and family. Dr. Boyd, I'd like to start with you. In your experience, are there certain types of mental health symptoms that Black parents are more likely to notice than others? If so, why is that? And how might culture play a role in that?
One of the things that you tend to notice is that parents and caregivers raising children are more likely to notice externalizing behaviors. And that was noted in the review. These are the acting out behaviors, such as the oppositional defiant disorder, the ADHD symptoms. These acting out and disruptive behaviors are particularly relevant because these are the behaviors, particularly that youth get into trouble in other environments, such as school, and that can lead to negative consequences that tend to be disproportionately happen to Black young people. And these are concerns that raised by parents about their children exhibiting behaviors that will cause negative consequences. One of the things that is tend to be missed is that parents may not be aware of their children's feelings and thoughts unless the child, teen, young adult shares it with a parent or caregiver. And one of the things that we have noticed is that, and the research shows that parents with their own mental health history, they may be more aware of the range of mental health symptoms in their children. And so that may help them recognizing that their child is exhibiting something that behavioral symptoms that may lead to getting into treatment. One of the things that was brought up is that some symptoms can go across different mental health disorders, and it may be challenging for a parent to know what it means when their child is exhibiting a certain symptom. And this is why many times they may need someone else to observe it in a full context. One of the symptoms particularly is irritability that I think comes up and was alluded to previously. Irritability can occur in depression, anxiety, post-traumatic stress disorder, but also in oppositional defiant disorder and ADHD. This symptom particularly may be viewed differently for Black youth, and that may be viewed as aggression. Parents oftentimes mention their child may have an attitude, and that may get into conflict. And so may not recognize that that irritability is part of another group of symptoms that may lead to, trauma symptoms or depression. And so these are the things that that occur when parents see this. And it's also, I always encourage parents when they have a concern, they see a change in their child, to be able to go to someone to check it out, just in case, because it's better to be on the safe side and to catch symptoms early.
Thank you. Jonathan, my next question is for you. The research suggests that the idea of self-reliance can cause youth, young Black men in particular, to opt out of seeking mental health services. What are some ways in which the adults in their lives, whether it's a parent or other caregiver, a teacher or a counselor, can talk to them and help them understand that they don't have to face these challenges alone?
Yeah, of course. So first, I think it's important to understand that mental health, like a lot of the kids I noticed at my school, like think it's like they see it as weakness, like if you're down. And I think it's important to understand, just like your physical health, it's important to work on your mental health. And I know like a lot of parents may disoppose of mental health, um, but there's always other trusted adults at your school. Like I know for me personally, this year I actually like needed help, and I was able to talk to one of my career like guidance counselors, and she was able to help me talk with the school psychologist and get me on like a plan. And I think getting help for mental health, whether um, mental health will not only make you feel better, but it also helps you learn more about yourself as well.
Thank you. Thank you both. Faith, please continue.
Thank you. So next, I will be discussing how culture and family plays a role in mental health support for Black families and youth. Religion and spirituality is known to be a significant part of Black culture, and research has recognized that it can be both a deterrent and a facilitator for accessing mental health care. Religion can be considered a barrier to care when rigid ideals within the religious community keep parents and youth from seeking care, or caregivers turn to prayer or spirituality to cope with emotional distress instead of, rather than alongside, seeking professional help for their family or child. And religion can be a facilitator of care when religious communities include support for efforts to seek and engage in mental health services, or when mental health providers work with religious organizations to increase access to care and increase awareness of mental health care services. As you discussed with Jonathan, the idea of self-reliance, or taking matters into one's own hands, is embedded deep within Black culture. It's been a protective and often necessary act of resistance against centuries of enduring white supremacy and systemic racial discrimination. But in terms of mental health care, it may actually be negatively impacting our Black youth, specifically young Black men. And in studies involving Black college students, higher percentages of young Black men were more likely to opt out of mental health care, believing that they could take care of it on their own. But studies show that participants on campuses who chose to handle their mental health care on their own were significantly less likely to benefit from the services, while they were still displaying higher rates of having those mental health challenges. This also ties into the fact that mental health is still largely stigmatized within the Black community. In several studies, Black parents and youth mention stigma as the main reason for avoiding mental health care services. And when compared to white and non-Black adolescents, Black youth were much more likely to hide their internalized mental health challenges from their parents, and cited that a lack of support from their family kept them from accessing mental health care. But Black caregivers did say that a less formal way to receive mental health, such as mentoring programs, was less stigmatizing than the regular form of mental health services.
Thank you, Faith. A couple of questions for the panel related to the mental health care system. Dr. Boyd, I'd like to start with you. Research in mental health has historically been conducted by white researchers and informed by white doctors and white patients. So how do personal and institutional biases impact the diagnosis of Black children?
It is very important to acknowledge the historical background, in particular that the research in mental health has had a deficit model of Black people. And so the impact of this view is widespread in our theories of mental health and the types of studies that were conducted in which our mental health knowledge is based. And so we do have to recognize that to be able to be corrective in this way. There is also a challenge, and it was brought up earlier, that it is considered that when you diagnose or look at children and young adults, that we have sort of diagnostic symptoms, and there's maybe an expectation that the disorders look the same among Black people versus other races and ethnicities. And we cannot assume that. And so that is also a challenge that we have. Providers have their own implicit biases, as most people do. And these are compounded by the biases that they received in their training, as well as the inherent biases in the research evidence that we have. And that impacts the practices that are done. So these are many biases compounded upon each other. Culture and context matter, and it has to be considered in the assessment and treatment of Black children and young adults. Really taking a socio-ecological perspective and understanding the presentation of symptoms that inform diagnoses. This may be missing, and it can lead to misdiagnosis, missed symptoms, improper treatment. But also key to doing diagnosis and treatment is this rapport, this therapeutic rapport. And that is important to develop. And so these biases can lead to families, as they're mentioned, not wanting to participate. Youth and young adults may not be fully open with the provider. And so that causes challenges if the provider is missing information that can be helpful. Institutions must be more intentional to figure out how their practices and their staff impact Black clients and patients in their system. It can't be sort of a secondary thing to look at. It has to be a priority.
Thank you. And for Dr. Alexander, when parents or caregivers do seek mental health treatment for their child and encounter some form of racism or discrimination from their provider, they can feel discouraged from continuing to seek care. So 2 questions for you. Can you offer some advice for how those parents can move forward? And what language might they use when describing their child's needs to affect a different or more favorable outcome?
Definitely. I think in general, it's hard to know how to respond in these situations, right? Like especially when it occurs with like a trusted provider, it makes sense that feelings of like hurt and anger and anxiety come up, right? And that you're feeling in these moments like judged, misunderstood, or even like the worst case scenario to be thought of less than, right? And so I really would encourage parents to first validate like the experience with their child. And by validation, what I mean is like helping your child to understand why it makes sense that these emotions come up, right? It doesn't mean that what the person said to you or did to you is right. And all of these other pieces, we're really just saying like it makes sense that these emotions come up for this situation. And then from there, I would say that you want to consider what you want to model to your child, right? Or a teen or a young adult, right? I still check in with my mom when I need advice, right? That you want to communicate, advocate, and then consider a repair, right? Like these are still moments where, if the person didn't realize that they were saying something that was racist, that this could be a moment to communicate the hurt that was felt, what was the circumstance or the situation, advocate for what you would have wanted different or what you would want different in the future if you are interested in continuing the relationship, and then talking about how to make that change. That said, as we talk about in general, like it isn't your responsibility to educate every person that may say something that's racist or a prejudice or discriminatory. It is not your responsibility to educate them, though if you choose to and want to maintain that relationship and feel like there is a room for learning, that you open that conversation, saying things like, I took a moment to really process that, or that comment made me feel uncomfortable, or my child expressed the situation to me that they felt uncomfortable by, and I can see from what they're saying how uncomfortable I would feel. Tell me more about your thoughts. Tell me more about how did the situation come to be, or what were you trying to convey to my child, in order to like open the conversation with curiosity and hopefully like bridge a repair.
Thank you both very much. Faith, please continue.
Okay, next I will be discussing intervention initiatives that were suggested in the research. In this instance, an intervention can be a form of treatment or a program that either prevents or mitigates mental health challenges. Several studies have highlighted the significant psychological toll that exposure to racial discrimination has on Black youth. This suggests that racial discrimination causes a specific type of trauma and therefore needs a specific type of trauma-informed care that will provide children with the tools they need to deal with the emotional and psychological weight of racism. And by early adolescence, many Black children have already experienced some form of discrimination or racially charged event. It's also important to note that different populations within the Black community may have different trauma responses to racial discrimination. For instance, in a study involving both African American and Afro-Caribbean adolescents, both were found to be negatively impacted by racial discrimination, but displayed different trauma responses, highlighting the need to take the heterogeneity of the Black community into consideration when developing interventions. Strong family relationships has also proven to be an important part of mental health support for Black children, suggesting that providers involve parents in every step of treatment, which could include informing parents about mental health disorders and treatment options, as well as addressing their fears, which could include provider coercion or involuntary hospitalization. And this is based on a long history of mistreatment of Black children and families within the healthcare system. Research also suggested that the entire family be included in therapy sessions. Several studies have also emphasized the importance of culturally adapting interventions for Black patients. This could include incorporating culturally relevant risk factors and traditions, using culturally informed assessment measures and evaluation, employing more Black and/or African American mental health care providers and Black providers in general, as well as training faculty members and campus staff on cultural issues.
Thank you, Faith. So I'd like to invite all of our panelists to answer this question, but I'll start with Dr. Boyd. Dr. Boyd, what are your initial thoughts regarding the suggested interventions, and what do you think a successful intervention targeting Black youth might look like?
One of the things that stuck out to me is the cultural adaptations. This is critical and important to think there's not a one size fits all for interventions and therapy, and that it's important to adapt to the Black community, but also to allow flexibility because of the variability within the Black community to be able to deliver an intervention to fit the needs of the population that you're working with. Also, there is a need for this increased awareness and communication about mental health within the Black community, educating about what to expect. And this was mentioned previously about sort of understanding what happens when you go to treatment and talking about these issues. It's also important to deliver interventions in settings that are acceptable and accessible. That's we expect people to go out and travel to different places that may be far. And so we do need to think about how we deliver interventions differently. And always, which I mentioned, primary prevention matters, teaching young people interpersonal skills, emotional regulation, safe opportunities to grow and learn, setting up these environments so that kids won't advance to more serious mental health disorders later, that we need to think through those things and what do they mean for teaching Black youth those types of skills early in life.
Thank you, Dr. Boyd. Dr. Alexander or Jonathan, same question. What are your initial thoughts about the suggested interventions, and what do you think a successful intervention targeting Black youth might look like?
Yeah, I think, I second that with Dr. Boyd's thoughts. And what I could add is, an area that I've been particularly passionate about is really the experience, the cognitive experience of microaggressions and moments of experiencing like bias. Sorry if you hear some background noise. But ultimately, there are moments of insecurity, questioning self, questioning if this experience is accurate. Am I actually reading the room and did I actually experience this type of judgment, right? And that it creates a lot of self-doubt. And within the model of, say, cognitive behavioral therapy, we can pair those thoughts of self-doubt onto distorted thoughts about self that aren't accurate, right? Like, you don't have to believe that you're worthless or that you're inferior or not valued in this space, even if that's what was put on you. And so I think that area of research and really creating a theoretical model of how to map these beliefs onto what we know about distorted thinking traps.
Thank you. All right. Faith, thank you.
So it's also important to discuss the limitations of this type of literature review, so we have a better understanding of what information is still needed regarding the mental health of Black youth and families. So some of the limitations is that the studies included in this analysis varied in size, with some including fewer than 20 participants. So as we know, in order to further prove the efficacy of a study, we need larger population sizes. And this review was limited to peer-reviewed research published within the last 5 years. More information on the preferences and experiences of Black families with telehealth or teletherapy might show important considerations. Several studies focused specifically on perspectives and behavior of Black male youth and adults, and less focused on other genders. And more studies that acknowledge the heterogeneity of the Black community, as previously mentioned, can provide more insight on the mental health needs of Black families.
Okay, again, I'd like to pose this question to all panelists, but Dr. Alexander, I'm going to start with you this time. What are your thoughts on the overall lack of research about mental health care for Black families as reflected in this literature review, and how might we fill those gaps in both this survey and future studies?
Yeah. I mean, I think broadly, the lack of research really means that we as providers are working with too incomplete of a picture, right? So we are working with what we have, and doing what works, and it's incomplete, and that we really want to emphasize the need for inclusivity and for identifying the social emotional risk factors for the Black community, right? And what are the factors that are getting in the way of their treatment, which is why we're having this panel and this discussion. I do think that the next step is similar to what I was suggesting earlier, is really to develop, test, and evaluate the efficacy of treatments that have been adapted for our community, as well as considering ways that and theoretical models that can be added in or mapped into the treatments that we do have. Those that are working with family systems, those that are addressing racial bias and discrimination, and then the factors that are most challenging and contribute to mental health challenges with Black youth and young adults.
Thank you. To Dr. Boyd and Jonathan, same question. Thoughts on the overall lack of research about mental health care for Black families as Faith has presented to us today, and then how might we fill those gaps?
John, you want to go? Go ahead.
Yeah. I feel like definitely there is a big lack of research in mental health services in the Black families. And I understand that um I noticed that mental health recently has had a big spike on the world in general. And I think over time, like there will be more like research, and I think it's important that we were doing this panel and our literature review because I feel like we exhibited a lot of research that wasn't out there that maybe like people can learn from. And also like I feel like another way that we can like help with the mental health and like services is as you can see in this panel, all of the panelists are all women, and I'm the only man. And there's a really big lack of men in the mental health field. And I know that for me at least, like, and I know with a lot of young men too, like sometimes it's hard to open up to like someone you don't know that's like a woman. But I feel like opening up to men is like more easier for me. And I think that like if more people, like more men, just like start like participating in like becoming therapists or like psychologists, I think it could make a like big jump for like the whole of mental health like in general, because we definitely need more men to be working in this industry.
Thank you, Jonathan. Dr. Boyd, would you like to add?
Yes, I think there's huge gaps that has been noticed in general research focusing on Black families, Black children. There's so much to learn, and so I will go. One of the things I think is important that a lot of the research that we do focus on or low income Black families and children that it's not clear. And so the important thing is to make sure we get across socioeconomic status, because I do think there's missing information that we don't know about middle-class Black families and upper middle-class Black families when you look at the research and kind of knowing that. Um, Piggybacking on what Dr. Alexander said, there's actually not much evidence for interventions that actually have been supported for Black youth. Um, it's really actually horrible. And so we are out practicing with evidence that we don't know if it really works with Black children. And so I think people may not know that. So we're saying that this works in the general population with children, but we don't know. And so there's a lot of intervention research that needs to be done because it's what's been, interventions have to be delivered. People show up in your offices. And so that is another gap in which we need to really address. So I will leave those two. And so I know we may have more discussion about things later.
Thank you. Absolutely. In our remaining time, I'd like to open the floor to audience questions. We have received some questions throughout, but if you have additional that you'd like to ask, please feel free to add those in the Q&A. I'd like to start with a couple of questions that we've already received. The first is, what can be done to increase the number of Black mental health professionals who are available to Black families? And I'd like to start this question, Jonathan, if you don't mind. Can you tell the audience a little bit about the Youth Mental Health Academy that you've participated in and why you chose to do that and how it relates to your future plans?
Yeah, of course. So YMHA is like an amazing program. I was actually the first year where they started it. Um, I think I first joined it. I wasn't really sure what I wanted to do. And I know I was a junior and I knew like college was coming and I had to figure something out. So I was like, I got introduced to it by one of the college and career counselor at my school. And I was like, okay, it sounds interesting. Like I'm interested in it. Like, so I participated and it made me like realize like this is what I have love for. Like this is what I like to do. This is what I want to do. Like this is something that I can see myself doing for the rest of my life. So definitely like it definitely opened up my eyes and made me like realize like, oh, this is the career path I want to take. Like I want to become a therapist for like the youth, like specifically like teenagers, because I feel like your teenage years are definitely the years where you need someone to talk to. Like you need help, like you need to be guided. Like even me, like I'm very like independent person, but I know like I need help. And I think it's important to understand like even though if you feel like you're the rock, you're the shark, like you don't need nobody, like you always need somebody. And it's always nice to have like that support. And I think that's like really important to like understand.
Thank you, Jonathan. Dr. Boyd or Dr. Alexander, anything that you feel we can do to increase the number of Black mental health professionals who are available to Black families?
Yes, I mean, I really appreciate Jonathan's point about also working with the College Counseling Center. I think for my own experiences in high school, growing up in Queens, that I spent a lot of time in the College Counseling Center for tons of reasons, you know, credits as well as learning. And psychology was not even on the radar at that point. And what I would say is that within that space, this is the space to really learn about the variety of careers that are at your disposal, right? That you can select from. And I think that I learned a bit of that in the College Counseling Center. So really working with those college counselors, guidance counselors to offer those suggestions, as well as, you know, moving through college and kind of learning the process between, you know, a bachelor's and a master's and, you know, a doctorate, and that there is a bit of flexibility in becoming a therapist depending on a master's or a doctorate, and different types of specialties, whether you're a social worker or a mental health counselor or a psychologist, right? That there's a lot of variety that I don't think is often talked enough about, both in high school as well as moving through undergrad. So we do really need to increase the conversation with those who have the most contact with our youth.
Yeah, I would like to add that I think it's important to set up programs, pathways to mental health care, that we need to do that. I know at my institution, we have, you know, summer programs for high school students, college students, and having them being exposed to mental health, as well as maybe the STEM programs also looking at. So we do need to work towards these, and starting early in high school, I think, is important for this exposure. You know, career days at high schools, all those kind of fairs, really, you know, putting mental health out there to let them know that that's a viable career for people. And you may not always need to get your doctorate. There's other levels to be a therapist. And so we do need to work on that across all the mental health fields, because we do not have enough mental health providers, and particularly who can, of color and Black, and who can treat children. So we haven't brought that up, but not everyone can have the expertise to treat children, and that's important.
Thank you all for your really thoughtful responses to that question. Our next question is telehealth something that might make a difference in making care available to Black families?
I could jump in on that
Okay.
one. Right. And so we're talking about like the idea of really prioritizing telehealth over in-person care. Right. And, you know, I think, you know, this has been a big change since the pandemic, right? It both came with benefits, right, and costs, right? So benefits are that, like, you know, during the pandemic, there, you know, so many people were struggling in one way or another and really needed access to treatment, and to really pause all care, all in-person care because of the mandates, you know, would have just been a detriment to those who needed mental health care. And so what came out of that, I think, is that we realize that there are many people that can receive good quality care and see themselves progress over time with telehealth services. That said, even in my own experience, making the decision on whether or not I would want to see the patient via telehealth or in person, I do think that sometimes, both from a clinical standpoint, there can be missing data from the nonverbals and being able to support the patient through a moment of really intense emotions and having that in-person connection. I think that also, if we're working with some individuals who may have like attentional problems, it can be really challenging to bring the attention one mindfully into the virtual room, if you will. Right. So I think that we're still in a space of making like there's no mandate on whether it should or shouldn't be telehealth, but at the same rate, it becomes a clinical decision on what really works best for the person that you're treating. And that, I would never recommend like a full mandate of we should just move towards telehealth based on one, culture or one specific type of diagnosis, that it is based on like the connection and the engagement in session, to make that decision.
I'll just add, telehealth, I think particularly with the transportation issue has been, the one of the most positives that I've noticed. Teens who used to have to take buses and subway to get to be after school and then go back home do not have to do that. And when that piece of helps a lot. And I've actually noticed that a lot of the teens prefer to do the telehealth a lot more than I thought once we move back to it, that they prefer that. But I do know that rapport, if you have to work on building the rapport. And then oftentimes you see things into the home that you would never know them coming into your office, which, gives you some insight in how things go too. So we don't know for sure, but there's pluses and minuses on both ends.
Thank you all. A related question, you alluded to this in your response, Dr. Boyd. Do the financial barriers described suggest that expanding school-based mental health support is the most important thing we can do to get care to Black children who are going untreated?
Happy to jump in. It's, like some of my earlier or much of my earlier training has been in school psychology. So like interning and training in the schools and seeing that, there are some school districts that only have one school psychologist available for multiple schools within the school district, and that they're shuffling between schools to offer their services, I think has been always a big challenge in the field. And that, both like there is an importance that needs to be placed on having more school psychologists and funding really for those school psychologists to be in each building, as well as guidance counselors and offering, I think, more in-service trainings on classic models of CBT and DBT and like all of these types of behavioral, cognitive and behavioral treatments, as well as talking about within these treatments cultural adaptations, right, for the communities that these schools are often in, at least within the 5 boroughs that I'm familiar with.
Thank you, Dr. Alexander. Dr. Boyd.
Yes, I think it is very important school-based. I mean, schools probably have the majority of kids at a certain point. And so they can't get services during the day or right after school. And so I think that is important to increase having school-based mental health services and it can take away for some of the stigma because it's normalized in a sense. You go to the counselor or it's part of sort of normal practice, and then they can pick up and work with the teachers, sort of helping with identification. So I do believe that there should be more services put there. I haven't figured out, which I've been thinking about, so many kids are now doing virtual schooling, and what does that mean about getting those youth? But I think particularly it's important to increase the school base. And I think there's some bills at the federal government to increase that. And so that is an area which it seems like there will be more resources available.
Jonathan, can I direct that question to you too? If there was more school-based mental health support, do you think that your fellow students would engage more freely in those supports?
Yeah, so first of all, I'll talk about so I went to 2 high schools, and my first high school, they had a wellness center that you could go in, but there's only like one person in there that you can really talk to. And obviously, like when not everybody is going to be able to relate to that person and be able to talk to that person because, you know, you need a different personality. You need someone who's going to like match with you. And currently at my new school, we have a wellness center as well, but the only difference is we have graduate school students from like Long Beach State and Cal State Dominguez Hills who come in certain days and they will like come in to meet with students to like talk to them. So I know maybe other schools aren't like as advanced as my school, but my school, I feel like the way we have gone through it, like we've done really good. And I think part of the reason why is though as well, our school is pretty small, so we have a little bit more funding than most schools. Like I know a lot of schools have like thousands of kids. I think we only have like around 1,000. So obviously, like we have more funds to put into a wellness center and like hire like interns or like people who like are able to help. So I think that's important. But definitely like at my school, I noticed since I go to school in Compton, California, a lot of kids think they are like, like I said earlier, like they don't need no help. And I think it's ultimately like you have to, it takes a lot of like self-realization and like self, um, like you have to be like self-aware to like understand like if you're not okay, like you can't live being not okay. And it's super important to always look for help. And not even like you don't even have to go to the wellness center. Talk to like one of your friends, because I know a lot of kids like don't really open up, but like even your friend like can help you. They might not be licensed to help you, but if you need to get something off your chest, like I've done it, like where you need to talk, like your friend is just, especially your close friends, are just there to take in that information. And it's really important to like have somebody, whether it's a friend, teacher, parent, like whoever.
Thank you. Thank you all. Dr. Alexander, this next question is for you. Would you please speak a bit more to what you shared about the cognitive experience of microaggressions and using CBT to map common cognitive distortions?
Yes, yes. So broadly, this can become its own seminar. But broadly, we think of, in the CBT theory, that there are these distorted types of thoughts or thinking traps or thinking errors, many different ways to call the same thing of mind reading, black and white thinking, discounting the positives, only focusing on the negatives, labeling yourself or others or the world, or self-downing in some way, so judging yourself in a negative way. And so what happens during a moment of experiencing a microaggression, there will be likely moments of questioning. So questioning, did I hear what I just heard? Is what they said, did they say something wrong? Is it really wrong? Am I reading too much into it? And however we answer those questions could map on into both mind reading. It could map on to labeling yourself or the other person in a way that ultimately triggers really intense negative emotions, right? And so we're not saying that for example, someone actually says something that like is clearly racially driven or some sort of negative judgment, othering. So say that actually does happen. Well, now what do you think about yourself? Right. And so if you think, it must be true, some of those, imposter syndrome type ideas of like, I don't belong, I don't actually fit in, I'm the only one here, and therefore it must be true that I don't belong. Right. So if those are going to be the thoughts that come up, if they're triggering really intense negative emotions like anger or intense sadness or intense self-doubt, that needs to be treated, right? Like no matter what other people say, no matter how much, it's how wrong it is, we can't let these negative beliefs from, the broader, like from various individuals in the broader community shape how we think about ourselves and what we know to be true, right? And so you can still disagree, dislike, disapprove of what was said without it turning into intense depression, anger in such a way that actually like results in you leaving a place that you own space in.
Thank you very much. Our next question. The presentation notes that less formal mental health care, like mentoring, is a way to reduce stigma. Would a focus on seeking mental health skill building be another positive, less stigmatized way to reframe mental health care?
I can start. So I actually like I play football, and sometimes I'll help the football team, and they have mentors who like come in and talk to them. And they actually like talked about this the other day, and they do believe that like when just using the word mentor, like it reduces complete stigma because I feel like a lot of people when they hear the word like therapist or therapy, like you think, oh, I'm crazy, oh, like I'm this or like that. But when you hear mentor, you think of someone who's going to teach you how to live life, like someone who's going to teach you to do things. So I think like for answering that part of the question, like definitely like just using the word mentor, like definitely reduce a lot of stigma because I feel like people just think the word mentor has more positive connotation than like therapy.
Thank you.
I think it's important to note that research does show that having a positive, supportive relationship with adult, which I think came up, is helpful for beneficial for young people. And so that's what the mentor provides. In a sense, you hope that you can provide a mentor and that you won't, you'll get the support you need, that things won't advance to much more serious mental health issues. That is sort of a way when you think about prevention early on, having that support that will be helpful.
I would also add, like, I'm having two thoughts. I'm having one thought of a rose by any other name, right? And that once the support is being provided, and to what Dr. Boyd was just saying, like that is key, and then that there is rapport. I also think that within those conversations with the mentor, that something that I would like to believe happens in therapy sessions is that we're also skill building and supporting the person in developing their own problem solving skills, right? And saying that like, yes, I see what's happening, but instead of having the therapist tell you exactly what to do or exactly how to solve the problem, that we collaborate on figuring out based on your values what would be the best solution for you in communicating through that challenge, whether it's with a parent or a teacher or a friend or in a romantic relationship, that we're not necessarily placing our values onto the other person, but we are guiding them in identifying their own values and then supporting them in figuring out how to engage in a way that's aligned.
Thank you all. Jonathan, I have a question for you. What do you think are the biggest obstacles in terms of mental health for teenagers your age?
So what I think the biggest obstacle is definitely their like being self-aware and understanding like when you need help. Like I said earlier, a lot of kids like just like to hold it in and like not let it out. And also that's due to like the fact that maybe in their household they don't see like people expressing their feelings, so they feel like they can't because they look up to the people in their house as their like family and like the people they should follow. So I think naturally if you see they don't do something, you're not going to do something, and if they go do something, you're going to want to do it. And I think also a big struggle that I noticed like coming to a school like in Compton and even for myself is a lot of teenagers nowadays they don't have both parents in their lives. And I think that definitely takes a big toll on people or like students because for me personally, my dad had left and I was distraught. Like I couldn't wake up in the morning. I couldn't make it to school. I didn't want to get ready for school. I barely like even wanted to like leave my bed. And I think that was like a really big obstacle a lot of kids like have to deal with. And um definitely like I said too, like that's kind of around the time where I started like therapy and stuff like that with the school. And I think it like just, I don't know, like some type of magic, like it just made me feel better like almost instantly. And I was able to like, resume the tasks that I normally would do, because people see me like I'm like the jubilee person, like I'm always happy, smiling, talking, making jokes. And people noticed like I was different, and it sucked obviously, but it just because I felt some type of way because of what happened in my life. But eventually I became like the same person I was before. And um, I just like a big thing I learned too was obstacles are like inevitable. Like you're gonna face obstacles, but it's important to respond to them in positive ways and just like not fall. Like, how do I say this? It's important to not like see those challenges as like barriers, because there's always like a way around them.
Thank you for sharing that with us. Our next question is for anyone on the panel who'd like to answer. What are the best ways we can push to make information about mental health care more accessible to Black families?
I think we have to do a campaign. I do. I think we have to, there's public health messages. People know how to put information out to get the broader community, and that we have to do it that way as a communication strategy. Go into places, communities, primary care providers, churches, mosques, religious. We need to put it all out there, schools, where youth and young people, and get the information out as a campaign. So that's what that's it. We have to do it that way.
I think the campaigning piece is huge. And, you know, just having a partner that also works in streaming services, it's also often a conversation that I have with him about, like, this should be a collaboration in some way. We should be a part of, these streaming services. That is how, many of us are even spending a lot of our leisure time on streaming services, and yes, social media as well, but really trying to find a way to have, like, say, this long form discussion, televised, but via streaming apps.
Yeah, I agree with that, because as like a young person who is on social media and streaming apps, I feel like you see like the commercials and stuff, ads, and like sometimes if it's interests you, or like, and you'll like pay attention to it. And also the way to like just spread like more is we need to use our voice. And like was said, come together and campaign, stuff like that. I think it's really important because it shows that there are people who like care about this problem and want to change it. And I think seeing that is very inspirational to other people. And they will eventually, want to follow like the movement or what we're trying to do to increase the mental health like services.
Thank you all. Our next audience question is related to school. The research notes the high percentage of Black children who have experienced racial trauma. Can you say a little more about what trauma-informed treatment and trauma-informed school curriculums are and how they work?
Can jump in on that one. While I wouldn't say that I am, my specialty is definitely not, strictly trauma-informed work. Though in studying trauma-informed work and working with schools, I have seen that a lot of models do focus on resiliency, right? Like, so building that sense of resilience, as well as like self-validation, as well as, in some ways, when possible, working with parents and informing them on like what validation looks like. That when your child is experiencing, a certain range of symptoms, whether it be physiological based anxiety, so like intense heart rate, hyperventilating, crying, and a lot of those physiological responses, how can you, really validate, like, it makes sense that you're having these emotions and these experiences, and, let's work on a coping strategy of some kind in order to calm some of that intensity, and then open discussion about what brought that experience about for the person, right? I think it is also a lot of mind-body awareness, which is that physiological awareness, saying that, when what happens with trauma symptoms at times is that you may not be in the actual situation that is linked to that trauma, but you may experience derivatives or versions of that experience, and then may experience the physiological symptoms. And so you may first start noticing your heart racing, or your palms getting sweaty, or that you have a headache or something or other, and that as you're experiencing those symptoms, you may kind of lose sense of like, where is this coming from? Why is this happening? Is something wrong with me? So again, questioning yourself, self-invalidation, and then bringing it back initially to grounding yourself in the moment, taking some deep breaths, working on those coping strategies, then to move forward with processing the situation, either with a therapist or with a parent or school counselor.
Thank you, Dr. Alexander. I have a follow-up question about campaigns. What information should be included or prioritized in campaigns, and what are the most important things people should know?
I think one of the things that come up is sort of the identification of sort of what is mental health. Also, when there's a problem, and the types of steps you can take to get help. It's sort of, to me, those are the big things that come up a lot, and those are the questions I'm asked when I go to community settings. Like, how do I know when my child has a problem, when it's normal, and just putting some things out there. And that it's true, because there's a lot of misinformation out there. So you want to make sure people have correct information. And those people who do PR and stuff may know how to put it in nice, short ways to get out to the community. But those are the three that I think are important.
Yeah, I would add, definitely to a point Dr. Boyd you made earlier of the difference between the externalizing behaviors and the internalizing behaviors. I think a lot of parents struggle with seeing that difference, or knowing when, like, if it hasn't reached the point of an externalized behavior, then therefore it's not as serious, or it doesn't require that level of attention. So, and also thinking about, like, in terms of a campaign, like, who's the audience, right? So the mental health professionals, or rather the school community, like, the information that we want to share with them may look a little different to what we would be sharing with parents, and to what we would be sharing with the youth as well. And so, moments that we can do these in-service meetings for each party, and set it as a requirement, as opposed to a meeting that they can choose to attend. I think that's a great start.
Thank you. Thank you to the audience for your questions, and for our panelists' very thoughtful responses. At this time, I'd like to invite Faith to talk about next steps.
Thank you. Yes, first of all, thank you everyone for attending this event. One of the points of this panel is also to further inform the survey part of the study, which is currently happening, but we are creating the questionnaire for that. So we wanted to use some of the comments and questions from you, as well as our panelists, to better inform the questions in the questionnaire. And we will be sending out an email after this, which includes the recording as well as the panel slides. And you will have an opportunity to answer some of the questions that we've asked the panelists here today. And as I mentioned, the final report of this study will be posted on the Child Mind Institute, Steve Fund, and Morgan Stanley websites when it is complete next spring. I will make sure to notify all attendees when this occurs. And as you'll see in the chat box, we have an email address that you can send any unanswered questions or comments to. And like I said, we will be sending you a follow-up email as well. But yeah, that's it. Thank you so much for joining. This has been great, and it's been great listening to the panelists talk about their experiences and their expertise. Oh, I see we have a raised hand. Damaris, do you see that?
I do. I'm going to need Dwayne's assistance in.
That's all right.
Okay.
Sorry, I got distracted.
Okay. In closing, I'd like to thank our partners from the Steve Fund and Morgan Stanley, as well as my colleagues at the Child Mind Institute for all of this amazing work and for making this webinar possible. I'd like to thank our panelists, Dr. Alexander, Dr. Boyd, and Jonathan, our presenter and the organizer of all of this great work, Faith Wilkins, and finally you, the audience, for joining us today in what we hope is the first of many discussions on this important topic. So thank you for your time and your participation today, and this concludes our webinar.